Hi, y'all. So, 5 reasons why we love midwives. I'm Dr. Fatu Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. We love midwives. Midwives are so important in the history of mankind. Midwives have been caring for pregnant women since the dawn of time, before medicine was invented. Before doctors existed, midwifery was there. So they're very, very important part of pregnancy care historically and even to today. And we love midwives for a couple of reasons. Number one, midwives are the normal pregnancy experts. We have here in the US, we have certified nurse midwives. They know all about what a normal pregnancy is. They don't look at pregnancy as a medical condition, as an illness. No, it's a normal physiologic thing that happens. So certified nurse midwives are very, very well educated. They have to go to college for 4 years to get their bachelor's. A lot of them then get a 2 years master's program, and then they have countless hours of hands-on experience learning how to be a midwife, so clinical experience on top of that. So very well trained. Midwives care for women when they're not pregnant, so before pregnancy, trying to get them ready for pregnancy. They care for them during a pregnancy, and then they are there to deliver the baby also. Very, very important for women's health in general, but really definitely the normal pregnancy experts. Number two, we love midwives because they provide excellent labor support. I've had the privilege of being cared for by a midwife, and 2 of my babies were delivered by midwives. Midwives, because they see you all throughout the pregnancy, they have the opportunity to bond with you and your family in clinic, during those 9 months of pregnancy. And then when you're in labor, the midwives are there to provide care for you during that whole labor period. Typically, the role of midwives is delivery. So they are there in the hospital with you. They spend a lot of time with you, and that's a little different from, OBGYNs. For example, I take call with midwives. We'll take calls together. But me as the OB on call, I take care of everything. If someone comes in and has an ovarian cyst, that's ruptured, or there's an emergency or a C-section that needs to happen, or all of these. So I provide that overall care, but a lot of times I'm gone because I have to handle, kind of complex emergencies. Midwives are typically there for you for that care. So they are able to kind of spend a lot more time with you. Midwives are so that's number two. They provide that excellent labor support that you need. Number three, their midwives are independent. They can work independently, but they also collaborate to ensure that you have a healthy mom and a healthy baby. And this is critical. I really think the best model of care is when you have a midwife and a doctor working collaboratively to care for a patient. Midwives are known, to really have this holistic view of pregnancy care, of labor and delivery, of, being there for you. They can identify when there are problems and know when to call for support. So an OBGYN, for example, is there to back up a midwife. If there is a complication, if a C-section is needed, something else is going on, then they can call their OBGYN to kind of help. But midwives can practice independently, but they also collaborate to make sure that there's backup, because there are things that can happen during labor that need to be referred out. All right. So number 4, when women receive midwifery care, they're less likely to get intervention. So we like midwives because less likely for an intervention to happen. And I think this is because of their model of care. Women who are delivered by midwives are less likely to have a cesarean section. And this is in the hospital. A cesarean section, less likely to have, episiotomy in general. They have really, really good outcomes. There have been multiple studies that have shown that, at least in the US, if you have midwifery care that's backed up by a physician, you have those great outcomes. All right. All right. So number 5, we love midwives because midwives are very patient. Again, part of their training, they're there for you the whole pregnancy course. There are no pressures. They provide that support that you need during labor, and are there, to ensure that you have a healthy mom and a healthy baby. So, really, really, midwives are a really important part of our care model, and they provide good care in labor and during pregnancy. But what's important to know about midwives, though, in the U.S. is that they're hard to find. We definitely need more midwives. In the U.S., you're lucky if you have access to midwifery care because we don't have a lot of midwives. Midwives deliver only about 8% of all deliveries in the U.S. In the Netherlands, for example, midwives deliver 75% of all deliveries, so the majority of deliveries. So we have a long way to go in the U.S. There's a need for us to put more money into midwifery, to train more midwives, and to make sure that we have midwives available, because I think more women would benefit if they have that kind of collaborative care and a midwife is part of their team. So Black women, I'm sharing this important information about midwives because a midwife is an important part of your care team that you need to survive and thrive during your pregnancy. All right, bye.